So hi everyone, today's just 1 minute is about the fractures at the distal end of radius. So guys, this is one of the most important topic for your exam. The fracture distal end of radius can be of two types, extra-articular or intra-articular. The extra-articular injuries are Colles and Smith. Intra-articular injuries are Barton and Schoffer. Most frequently asked is about Colles. So whenever you look at the distal end of radius and the fracture is extra-articular with the distal fragment coming on the palmar side, we call it Smith, and the distal fragment when it goes on the back side we call it Colles. So do remember both of these are extra articular injury. That means the fracture line will not be getting into the radiocarpal joint. Now the Colles injury comes up with a Dinner-Fogg deformity, and the Smith fracture it comes up with a palmar displacement that creates a garden spade deformity. In the case of Colles injury, the plaster is given in the position of what you call as the glass holding. Hi everyone, today's just 1 minute is about the fracture at the distal end of radius. So we have two injuries here, intra-articular and extra-articular. Intra-articular injuries are Barton and Schoffer. Extra-articular injuries are Colles and Smith. Most frequently asked question is about Colles. So when you look at my distal end of radius, if the fragment, distal fragment comes on the palmar side, it becomes Smith. If the fragment goes on the dorsal side, it becomes Colles. Remember, both have to be extra-articular, right? The distal end, when it goes on the dorsal side, it creates for us a Dinner-Fogg deformity, and when the distal end comes on the palmar side, it creates a garden spade deformity. Okay, and both of these being metaphyseal injuries, they are treated conservatively. Okay, the position of plaster for Colles fracture, it is palmar flexion, the palmar flexion and ulnar deviation, which you also learn as the handshake position. All right, so don't forget the displacements in the Colles, that is lateral displacement, impaction, dorsal displacement and supination. So one of the most important topic for your exams.